the opportunity came available for vaccinations to be given to our general public overall, we noticed that we were getting a low turnout with our historically marginalized populations. And so with that, we actually walked our community ourselves. We made appointments and we're going into the community and taking the vaccine door to door to certain communities that did not have accessibility to get out and go get vaccinated.
People were not able to go to work. They were not able to take off work because of being sick. So we saw that there were a lot of needs around our social determinants of health, housing, food. So that's where a lot of our community engagement came.
Then you had the Advancing Equity Grant from the CDC, which in particular focused directly on how COVID-19 impacted populations that were underserved and that were at high risk. So that helped us to identify those populations, but also paying emphasis on the racial barriers, the ethnicity barriers, and the rural communities. And from there, that began the process of how we began to identify these individuals in these communities. What were the strategies? How do we assess our capacity of our organization to be able to address these concerns? And from there, developing those strategies, of course, with the collaborative health of the Healthy Communities team from the state and other equity coordinators throughout North Carolina.
Something that the pandemic really showed us is that people who are healthy and have transportation can go and get health care or go and live their life, but that people who have those complex medical issues that increase their risk of long COVID or severe complications, they're going to be staying at home, and we want to make sure that we are able to provide care as much as possible to them where they're comfortable, and then only have them come in for the necessary treatment.
I think one of the biggest things with a mobile unit is that it is literally a satellite location on wheels. I think that's a really huge, valuable tool that we have in our back pocket. And we have seen that by taking it to our people in the community and saying, we're here, we want to help you and provide these services, it really has a positive, appreciative factor from our community members.
We're all experts of our own lived experience. And so when we look at that communication, we got to look at not only the dynamics of the individuals in which we're serving and what they're dealing with, but also how do we take that feedback, how do we learn from it, and how do we create the plans from it?
So now fast forward, when we had RSV, when we have Black maternal health issues, people trust our community and our health leaders now to know that when we say something and when we encourage you to get something done, we see a positive outcome. We see a positive response and people going to get those things done.
So the message I will want to send out to the agencies is that continue to do collaborations, continue to reach out to other agencies, open up, those pipelines of communication and see what we can learn from each other, because through that active listening, you're going to be able to find gems that's going to be able to improve your practices and the things that you do, but that in itself can lead to better public health outcomes.
It's about allowing each person, each family to live their best life. We all live, work, and play together. We need to make sure that we have those opportunities that are fulfilling with each other.